Well, thank you very much for joining us and welcome to our webinar, all about weight loss surgery in Tijuana, your questions answered. My name is Luis Mendoza, and I am the Patient Relations Manager at Do It Bariatrics, led by Dr. Luisiana Valenzuela. And I'm very glad to be here because I'm going to speak about something that I am very passionate about it, which is medical tourism in Tijuana. Welcome. And if you have any questions, there is a section, a Q&A, that you can start submitting your questions, and I will be more than happy to address as many questions as you have. Okay. Well, the first step, what we are here for, is weight loss surgery in Tijuana. I'm probably not the best person to try to explain what is weight loss surgery, and I'm very sure that most of you already know about weight loss surgery and the different options, but we're going to cover them very briefly so we can get specifically about the CD. As you all know, weight loss surgery is a type of procedure, a surgical procedure that changes your anatomy to achieve weight loss. Typically, a weight loss surgery, it's something that you need to do in order to change your lifestyle and achieve your goals. There are like two kinds of bariatric surgery, or we can divide bariatric surgery in two kinds, which is the restricted bariatric surgery and the malabsorptive bariatric surgery. The restricted bariatric surgery, it refers to the kind of surgeries where the doctors, what they do, it's reduce the size of your stomach so you can eat less. On the other kind of surgeries are going to be the malabsorptive surgeries. And those kind of surgeries are the type of surgeries that changes the way food bypasses your digestive system. There are different, like I was saying, different types of bariatric surgeries that are very common, and most of you already know a lot about it. Obviously, if you have any specific questions regarding your specific cases, we will be more than happy to assist you. We will be getting all your information to the medical team so they can give you a definite and precise answer. Bariatric surgery is very common in the world right now. It's like the most effective method at the moment to treat obesity. Obviously, there are other methods. The first is going to be diet and exercise, that it's not effective for everyone. It's just a method. Obviously, it's like the more natural method, but it's not always effective. Recently, we have had a lot of questions and a lot of comments and a lot of online noise about medications to lose weight. Most of this medication hasn't helped patients achieve the desired results the way that bariatric surgery does. That's the reason why everybody in the medical community still considers bariatric surgery as the most effective treatment for obesity. And obviously, now that we are discussing this topic, the main reason why people choose Tijuana or consider Tijuana as an option for weight loss surgery is because of the cost. The comparison between cost of bariatric surgery in the United States, in Canada, or New Zealand, compared to the cost of bariatric surgery in Mexico, well, you're obviously going to save a lot of money. And not only money, a lot of time as well, that we will cover it later in the webinar. But this is mainly the average cost in Mexico compared to the average cost in the United States, and this is in US dollars. So you're going to save a lot of money if you choose weight loss surgery in Tijuana. Now, we're going to discuss the city and why Tijuana is considered the world capital for bariatric surgery. Currently in the world, there is no other place where as many bariatric surgeries get performed on daily basis like in Tijuana. Tijuana has become it's the top global destination for bariatric surgery. There's a lot of patients coming in on daily basis, and obviously there are a lot of surgeons and a lot of hospitals in the city that has transformed not only the landscape but the way we live in Tijuana. And today we're going to learn a little bit more about and how to choose the right surgeons. Tijuana, it's a city that we are right in the border with San Diego, California. It's right in the top corner of Mexico and the lower corner of the United States. In Tijuana, it's a very young city. Tijuana was founded only 200 years ago and has grown very fast. Right now, it's estimated that we live around between 2 million and 3 million people in Tijuana. And it's very hard also to count population here in Tijuana because it's a place where we have a lot of migrations. So a lot of people come to live and then go. So it's very hard. That's why all the official stats say that it's between 2 million and 3 million people living in Tijuana. Like I was saying, Tijuana, it's in the border with San Diego, California. So this allows us to have a very bicultural vision of life in general. It's very common for all the people to speak English here in the city. It's very common to see people from the United States in the streets. It's very common for people like me as Mexicans to visit the United States frequently. And this dynamic, it really shapes the way the medical offer here in the city. Like I was saying, Tijuana, it's a medical tourism hub. And this is very, very important to consider because being a hub means that not only we are receiving patients on a daily basis to the city, there are also a lot of doctors that come here to establish their practice, their medical practice in Tijuana. In the picture that you can see, actually, this is our office, and we can see United States from our window. But like I was saying, there's a lot of doctors that come here to Tijuana and establish their practice. And the reason, obviously, it's because it's to get more patients. But this dynamic, it's offering a lot of benefits for the patients in here because competition is very high. And the fact that competition is very high, it forces doctors, hospitals, and everyone like myself that we are involved in the medical tourism industry to really offer something that stands out from our competition. And not only that, recently in Tijuana, there's a lot of medical supplies companies that have come to the city and established themselves in here, their headquarters, their manufacturing, and a lot of things happening in Tijuana in the medical tourism industry that really offers you a lot of benefits. For example, there's a lot of companies in here where doctors can purchase the medical equipment in here. So that's one of the reasons why the cost is more efficient here in Tijuana. The other main advantages of Tijuana is that we are very close to San Diego. Actually, from our office, it's easier to get to San Diego Airport to the actual Tijuana Airport. So a lot of people coming from the United States, they are practically doing a domestic flight. They fly to San Diego, and it's very easy for us to be providing service to people coming for weight loss surgery in Tijuana since the moment they put a foot in San Diego. Like I was saying, it's very, very close. Crossing the border for people like us that we work in this industry is very easy. So when you choose and visit Tijuana, you're really going to have a very pleasant experience. And the other thing that I mentioned is the bicultural advantage. Tijuana's landscape really changed a lot since 9/11 in 2001, unfortunately. But before that, it was very easy to cross the border on daily basis. People like myself that we have been born and raised in Tijuana in our childhood was very common to cross the border just to rent a movie or just to pick something from the store. So that's one of the reasons why having this advantage in Tijuana, it really helped us to offer the best of both worlds. Most of the medical staff here in Tijuana are able to speak English and communicate with you guys. but offering the bedside manner that really represents the service that doctors can provide here in Tijuana. Like I was saying, why choose Tijuana for your weight loss surgery? Significant cost saving, shorter wait times, and personalized care. That's the best reasons why Tijuana, it's the place to be for bariatric surgery. Excuse me, do you have any questions at the moment that you would like me to address? Okay, well, I will continue with our presentation. Oh, wait, I think I have a question right now from Oksana. Yes, Oksana, do you want me to
Question.
hear you now?
So lately, I so another procedure that uh they're, they're invasive through esophagus. There is something new. Are you familiar with that?
Yeah, I wasn't able to hear you
Kind of
very.
stapling, some kind of stapling to esophagus. Is there any research on that?
On the staples that doctors use when performing the surgery? That's what you mean?
That is not invasive.
Okay, I probably think it will be better if you can type down the question, because I'm having trouble hearing you. I think you're getting disconnected while you're talking.
I will type it. Thank
Okay, well, yes, I will continue with the presentation. Well, I was focusing on the advantages and the benefits of visiting Tijuana for medical tourism in general, but specifically in this case for weight loss surgery. Okay, so what we're going to cover in this webinar, it's very specific points of how to choose your surgeon, how to choose your hospital, the importance of a medical facilitator, and how to have the best experience as possible when you're visiting Tijuana for weight loss surgery. Okay, first of all, let's talk about surgeon and surgeon credentials. It's very important when you are choosing or visiting Tijuana for weight loss surgery to really verify that your surgeon has the proper credentials. And this is sometimes complicated for a lot of patients from the United States, from Canada, from New Zealand, a lot of English-speaking patients, because unfortunately, the place where you can verify if a Mexican doctor has a license, it's only in Spanish. Okay, I will send you the links where you can check this information by yourself, but it's very easy. There's a website with the Education Ministry of Mexico where you can look the name of your surgeon and they will give you, or you can verify that the number of the license it's the correct one. And there is another thing that we need to address when looking for a surgeon. When looking for a surgeon, it's something very common. It's about talking about certification and when a doctor is certified or when it's not certified. There's one main college in Mexico for bariatric and metabolic surgeon that also has a website that also is in Spanish, where you can also verify which surgeon is certified and which surgeon is not. And when looking for this certification, it's also important to, specifically for weight loss surgery, to determine, because there are two different certifications. One is to be certified as general surgeon, and the other one is to be certified as a bariatric surgeon. So that's the reason why a lot of people that put on their websites that our doctors are double board certified. That means that they have the certification as a general surgeon and also the certification as a bariatric surgeon. Another tip that I can give for people looking for the right surgeon in Tijuana, it's to check their experience. And the experience is the number of surgery that the doctors has performed. A doctor should be able to perform more thousands of surgeries, and things like this are probably only possible, well, probably not only possible, but are very frequent in cities like Tijuana, where we have a lot of patients on daily basis coming for weight loss surgeries. Okay, and the same applies to hospitals. And this is another question and another topic of utmost importance, because there's also a lot of surgeons that are offering surgeries that are not performed on a real hospital. They are performed on smaller clinics, and that's also the reason why you will find such a difference in prices or in pricing. So when you look to the hospital, you need to make sure that the hospital has nice facilities, has safety protocols, that it's located on the place where they told you, that they have medical staff day and night. This is to ensure your safety. Another thing that it's, or another topic that it's also important in this particular topic, it's the role of the medical facilitator. Medical facilitators are companies that act as the middlemen. They help you to arrange everything that you need before coming to a weight loss surgery. So they play a very important role when you're trying to decide whether or not to visit Tijuana for a weight loss surgery. And it's very important to determine and for you to be sure if you really need a facilitator or you don't need it. If you are a person that likes to travel and that don't need really a lot of help on that regard, probably it's going to be easier for you to establish direct contact with the doctors or with the clinic instead of going to a facilitator, because it really can offer you a disadvantage instead of helping you. Our recommendation always is if you can choose communication directly with the doctors or directly with the doctor staff, it will be better for you so you can have a better experience when coming to Tijuana for a weight loss surgery. Our general tips for success are very simple. Ask questions, as many as you have. A really transparent company will be able to answer any questions that you have. You also need to understand the full cost. You need to have a plan for recovery, and you need to consider also all the things that can happen that surrounds your surgery. On screen, I'm going to show you some success stories of patients have come visited Do It Bariatrics, and then we are going to start with our Q&A session. So, do you have any questions at the moment? I'm looking in the chat to see if the question that was being made, I was able to answer it. Because I'm not seeing any questions here on the system. But I will be more than happy to address any questions that you have. Sorry, I think I'm seeing a question here. How far out can we book? Is a question by Nikki. You can usually when someone places a deposit here with us at Do It Bariatrics, at least that's our policy. You have a 1 year, so you will be locking your price for 1 full year. So our recommendation is to book as early as possible, because this way you can plan ahead, not only financially, but also regarding traveling, specifically if you're traveling for very far away, like yourself, Nikki. Okay, is there any other questions or any other topic that I can that we can discuss? Or something that we can assist you with at the moment? Like I was saying, our introduction, it was very brief. I was trying just to introduce, give you an overview, but the main reason why we're here is to answer your questions. Specific questions regarding traveling, regarding the traffic, regarding how to find doctors, or if you need any specific tips. Okay, I think that. Okay, Nikki, okay. One question that we are getting is if you guys can stay an extra night at the hotel after, and the answer is yes. If you decide to come with Do It Bariatrics or pretty much with any other company, you can extend your stay. Actually, it's very common for some patients that like to extend their place. And yes, we can help you with that. Most of the time, what we do is we can have the patient to benefit with the arrangement that we have with the hotels, so you can use for our special rates. But and the answer is yes, you can stay. You can stay nights after your surgery, as many as you like. Okay, and the other thing that that we can also help you guys with is if you need any specific medical question or you have any additional questions regarding specifically about the surgery, about the doctors, or about the procedure. One benefit that we have in Do It Bariatric is that you can also um, request a consultation directly with Dr. Valenzuela. I have an question by how often do you see low BMI patients, and what is the lowest BMI? We see low BMI patients frequently. There's not a low BMI. This usually it's determined case by case. That's the importance of the health questionnaire. When you submit your questionnaire, our doctors or medical team reviews it, and they determine if you're a good candidate for bariatric surgery. So probably the answer is yes. We see low BMI patients. The lowest BMI, it really depends, because if you have comorbidities besides obesity, the doctor could consider you a good candidate for bariatric surgery, regardless of your BMI. I have seen BMIs as low as 30, 29, I think it's how one time. And the other thing is that a lot of people doing the pre-op diet, they lose a lot of weight or they lose some weight, and the BMI is different since they started the process to the point where they are here to get the surgery. But the answer is yes, we see low BMI patients, and there is not a floor BMI that we can choose. Okay, feel free to ask us, like I was saying on the tips, feel free to ask as many questions as you want. It's our job to help you and make sure that you have all the information that you needed to make an informed decision. Well, guys, if we don't have any additional questions, I'm not going to take away any more of your time. Thank you very much for joining. Nikki, I'm very glad that you were able to join. And always, if you have any additional questions, you can always email me. My email is Luis. Sorry, there's. Do we have to do pre-op test at our own doctor? The answer is you don't have to. You don't have to do your own pre-op test at your own doctor. It's recommendable. If you have access to any pre-op test, it will be very important so you can share it with us. In that way, we can be more assured that you're a very good candidate for the surgery. But it's not mandatory, but it's recommendable. Okay, I think that really covers all of the questions that we have. I don't know if you guys have any additional questions, but if you do, feel free to contact me. Like I was saying, my email, it's Luis, Luis, at doitbariatrics.com. And I hope I have been able to answer your questions, but if I haven't, please rest assured that I will make my best effort to get all the answers for you. Well, I think this is going to be covering pretty much everything that we needed. Um, thank you again for joining us. And remember, if you have any additional questions, you can always email us or call us. Our phone number is 619-598-8133. We're also available on WhatsApp. And thank you very much for joining. Next month, we're going to be hosting a new webinar. So if you need for us to address any specific topic, feel free to ask us and feel free to recommend. Thank you very much and have a wonderful evening. Bye-bye.